Rehavior is a powerful tool that uses machine learning and artificial intelligence to improve client communications at scale for better patient health outcomes. Rehavior is needed because all patients are different. They have different mindsets and arrive at decision-making and choice through different pathways. The same message across all patients isn't effective for the highest likelihood of behavior change. Rehavior, through a series of simple questions, can create more tailored messaging for a patient, depending on Rehavior's determined mindset that the patient is in. Rehavior is a digital tool that allows medical staff to know what each patient needs to hear. Rehavior tells you what to say, how to say it, and to whom. Rooted in science, Rehavior has been effective in changing patient behavior across a variety of medical conditions like substance use disorder, cancer screening, prescription adherence, and mental health. Let's look at how Rehavior can be effective in communicating with individuals struggling with substance use disorder and recovery. Anyone working in addiction recovery knows that generic messaging just doesn't cut it. In this space, every patient's journey is deeply personal, shaped by trauma, trust issues, hope, and fear. One-size-fits-all messages often fall flat, missing the very motivations and barriers that define a person's readiness to engage or stay in recovery. By using Rehavior's motivation identifier, a healthcare provider can more accurately identify the mindset behind someone's substance use and what drives or deters their decisions around their recovery journey. This is Wendy. Rehavior has determined that she is a believer. She is motivated by belonging, doing right by loved ones, and being seen as good. When communicating with individuals like Wendy, emphasize community support, family impact, and the importance of showing up, reinforcing that recovery is an act of strength, not failure. Believers respond to positive, communal, and affirming messaging styles. Rehavior has determined that believers are less likely to respond to harsh criticism or shame-based framing. In addition, avoid overly individualized or self-focused narratives. This is Darnell. Unlike Wendy, a believer, Darnell is cautiously optimistic. He is motivated by hope, but with hesitation. He wants recovery to work, but fears it won't. He responds to practical support, clear next steps, and low-risk commitments. When communicating to an individual like Darnell, show that change is possible, but gradual. Emphasize progress over perfection without overpromising. Share examples of others with similar doubts who succeeded. When communicating with cautiously optimistic individuals, Rehavior has determined to avoid anything that feels idealized or overly spiritual. Avoid language that suggests you failed if results aren't immediate. And this is Carla. Rehavior has determined that Carla is different from Wendy and Darnell. Carla is inward-focused. She is motivated by meaning, autonomy, and internal coherence. Carla responds to spiritual or philosophical depth, emotional honesty, and personal exploration. When communicating with an individual like Carla who is inward-focused, a provider should frame recovery as a personal journey toward alignment and peace. Incorporate faith, spirituality, or life purpose as authentic motivators. Invite them to define success in their own terms. When communicating with inward-focused individuals, reflective, autonomous, deeper messaging is the most effective communication style. Rehavior has determined that when communicating with individuals like Carla, avoid rigid programs or top-down messaging, and avoid dismissive language around faith, emotion, or inner life. Knowing these mindsets can help determine what to say and what not to say to encourage the individual on their own addiction recovery journey. Rehavior data can be implemented through a variety of communication modes: verbal, text, email, call centers, marketing materials, telehealth, and can be integrated easily into existing digital EHR systems. Rehavior. What your patients need to hear.